Many facilities have yet to receive any of the COVID-19 vaccines that have already been administered at other healthcare locations.
Channel 2's Bill Spencer joins us live now from one of those emergency room facilities in Katy. So, Bill, what do doctors want to see happen here?
Well, Chris and Lauren, obviously these doctors, these nurses, the technicians that work at these standalone ERs, they want to get the vaccine. They want to be protected. There's also some concern about the rate of speed at which all healthcare providers and first responders across this whole state are able to get this vaccine.
Come on, who's next?
In the race to get healthcare workers vaccinated as quickly as possible, it appears one particular segment of the medical community has been left out. Those folks who work at dozens of freestanding emergency rooms.
We are the people that are in the trenches taking care of thousands of COVID patients every single day.
Rhonda Sandell is president of the National Association of Freestanding Emergency Centers and says of the more than 200 freestanding ERs in the state of Texas, less than 5 have actually received the COVID-19 vaccine for their people.
My emergency room physicians and my nurses are unable to get the vaccine.
Not only that, 2 weeks after the state of Texas first received its allocation of vaccines, 470,100 doses. The state's own website says only 139,747 vaccines have actually been given to people. That's about 29.7%. In Harris County, where 81,825 doses are available, just 22,195 have been given. That's 27.1%. The Texas Department of State Health Services is concerned enough that they sent out this letter to those holding the vaccine. Quote, "It has come to our attention at TDSHS that there may be unnecessary delays in administering all allocated vaccines. We direct all entities that have been allocated vaccine to administer their entire allotment with all deliberate speed. The time to vaccinate willing individuals is now."
Take a deep breath in for me.
As for the people who run those freestanding ERs in Texas, they say they can't even legally apply to get the vaccine at this time.
I cannot get the vaccine to protect my people legally.
Now, one of the things that the people that work at these freestanding ERs, what they can do is they can go to other places to try to get the vaccine because they are eligible for it, meaning they could go to HEBs, for example, or other healthcare providers that actually have the vaccine. But these guys, right now, most of them do not have the vaccine to give to their people. Coming up at 6 o'clock, we're going to tell you about one woman whose husband is a doctor working with COVID-19 patients and the link she went to try to get her husband vaccinated. And he works in a hospital. Reporting live in Katy, Bill Spencer, KPRC, Channel 2 News.